Bismillah walhamdulillah wassalatu wassalamu ala rasulillah. Other day we talked about chickenpox, and today we are talking about another virus which causes measles. So first we have to know what is measles. Measles is a disease which is caused by a particular virus. And its scientific name is not that important, but it's very common in developing nations where the vaccination is very low. So how this disease communicated from one person to the other? Usually, when the kids are sneezing, or they have some fomites which can be contacted by the other person, it leads to having the person infected. And how many days is usually infective? It's usually infective before the rash shows up, like for 4 days, and once the rash shows up, it continues to be effective for the next 4 days. And usually after 4 days, it's not communicable disease anymore. So to rephrase again, it's usually communicable before 4 days before the rash and after the rash is gone. So what happens in this clinically is that this virus spreads very quickly through the blood near to all the organs. So most important one amongst them is respiratory system. So it leads to the pneumonia in the kids or child. And the other complications which it can cause is the encephalitis or meningitis, where the infection grows inside the brain or inside the meninges or layers of the brain. So very important thing in this is that this virus starts with the infection of the throat and nose and of the eyes. So there's conjunctivitis in these children, and there can be inflammation inside the mouth, and they produce special kind of lesions known as Koplik spots, and it usually disappears before the rash appears. So since it causes a high grade fever, and having altered consciousness in case of encephalitis or severe pneumonia, the attending or the doctor try to treat it differently, thinking that it's a bacterial bacterial infection or the inflammation of the brain. So they are given lots of antibiotics, but suddenly one day come to realize the child has started to have a rash from the head, continuously spreading down quickly. So once more, if you want to talk about symptoms, there will be redness of the conjunctiva or the eyes. There will be a discharge from the nose, and child is sneezing and feels miserable in this case. So as we talked earlier, the encephalitis, so there will be altered sensorium, and in case of pneumonia, there will be very bad breathing. When this situation before that, you should try to talk to your doctor so that they can find out whether it's measles or not. Most importantly, the measles is identified by just looking at clinically, and sometimes you can isolate them from the other viruses if you want, like things like. So how to treat this child? Usually the best thing is go to your doctor, and I can say a little bit about how the doctor manages it. Usually if the patient has a problem with his inflammation of the brain or of the lungs, usually they are isolated and placed under the care of doctor. But if they are not distressed, you usually discharge home, telling them that you are supposed to keep the child isolated from the other kids, as this is very contagious. So you can imagine if the kids come in contact with a child who is infected, 90% of them will have the disease or clinical manifestation. So you can imagine how aggressive this virus is, leading to multiple infections to multiple people. So unfortunately, there is no drug which is used in measles treatment, although Western nations have some literature showing that certain antiviral can help in that, but it's not practiced in Pakistan or any other developing countries. So how we manage these kids? So first we have to take care of the child symptomatically. So what you do is make sure that the fever is in control, and you try to increase the hydration of the child, and you try to make sure that the airway and the circulatory system are intact. So to stop any other infection, because these kids can have superair infections, we have to give antibiotics, which can be very broad spectrum, as this infection can lead to having bacterial infections in any other part of the body as well. So on top of all these basic management, we try to increase the immunity of the child. Like, for example, we try to give kids like vitamin D and zinc and other micronutrients which can help the child to fight this disease. So to help the child to fight this disease, we try to give vitamin A, we try to give zinc and other micronutrients so that child can fight this disease. So this child can have multiple complications. First of all is the pneumonia, because it can be so aggressive the child is not able to maintain its saturation, and then we may have to put the child on ventilator, and it has caused lots of deaths in the community. And the other things we have to do is that if we are suspecting that it could be encephalitis, so we have to start antibiotics about that area. So there are certain complications which can happen like 10 years after or so. So for that, there's a very notorious disease known as SPE, which we don't have any treatment, and it leads to the death of the child. So now we want to know what is the technique or the way we can rescue our kids from this. The most important thing amongst the kids is that we should vaccinate these kids, as the kids who are not vaccinated, 90% of chances are that they will have the disease once they come in contact with an infected child already. The other way to prevent is that we should stop child going to the school where it can be infected to other kids, and make the child isolate himself into a room, and he should be taken care over there. And if it gets really aggressive, then you may have to go hospital. In the hospital, you will be kept in isolation so that you don't infect other people, and bacteria or viruses from other people don't infect you. So we'll talk other diseases on the way, and thank you very much for today.